Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijalma Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it. Welcome to the Birth Squad podcast. Please note that this episode covers sensitive topics that might be triggering to those who are dealing with depression or anxiety. Listener discretion is advised. If you're experiencing postpartum depression, anxiety, or other mood disorders, please visit moodhealth.com for virtual resources and insurance coverage details. Now let's dive in.
So today we have the privilege of welcoming Dr. Chowa, a buddy of mine, Atlanta-based physician who has been such a support and friend to me. So I am so excited to have you on the Birth Squad today. So welcome.
Thank you. I'm so happy to be here.
Yes. Do you mind introducing yourself to our listeners and share a little bit about yourself?
Sure. My name is Dr. Chowa. I went to school to basically practice emergency medicine, and I did that for several years. Worked in admin, worked in the ER, big hospitals, and then I transitioned out of that in 2023, July, decided to leave full-time emergency medicine to pursue a career in concierge medicine. And I started doing that and, just honestly just kind of fell into my niche where when I was doing home visits, I started to realize that I was having a lot of postpartum moms. And it took me back to my own story because I'm a mom as well. I had a really rough patch with pregnancy and postpartum. And so for me, it just seemed natural to be able to provide this service to moms, to be able to link them with other birth workers and also just guide them through, what is a really difficult time. So that's what I spend most of my time doing. And then also just being a mom to my 6-year-old.
I know you mentioned your pregnancy a little bit and how, it was a rough patch. And this is a question we ask of all of our interviewees, but can you share with us what your path to motherhood was like?
Yeah. So I entered motherhood with a big deal of anxiety. So I suffered a miscarriage about a year prior. And so my entire pregnancy was filled with anxiety, right? The anxiety of suffering a loss and not knowing if you're going to carry this pregnancy through the 40 weeks. And so for me, I think that was the most difficult part. And then I had bleeding during my pregnancy. It's just one of those things where it's like, I'm bleeding, because at least that first time you have to go to the hospital and get your little shot. And so, it was just kind of rough not knowing what's going to happen with the pregnancy. And then I had nausea well into my 20 something weeks. I had back pain. So I couldn't walk for 1 week straight. I hated being pregnant.
And that's okay. I tell patients that all the time. You do not have to love being pregnant.
Being pregnant is not for me. I'll do it again, but it was not for me. So
Wasn't your favorite thing to do? That kind of transitions to the next question. How did your experiences inspire you to now focus on postpartum care?
Yeah. So I think that, one, pregnancy, right? You go in, you see in your OBGYN, there's just there's not a lot of time to process a lot of things within the, that clinic visit. My OB did, his very best and he was great, but I'm carrying so much, right? And so I think during pregnancy, I'm trying to manage my mental health, right? I'm trying to figure out my whole back pain as, my OB is really just trying to make sure that I get through this, these 40 weeks. So for my back pain, I had to figure out how to get the resources that I needed. And so I went to physical therapy. It wasn't super helpful. And so then I ended up doing chiropractic work and massages every 2 weeks and kind of alternating. And, so I ended up doing a lot of that, which kind of helped me through pregnancy. And then the postpartum period, I struggled a lot with my just depression. And I went to my pediatrician, filled out, postnatal screen where they checking me for depression, failed it. They're like, oh, you're depressed. You should probably get some help, and then went to my OB and they're like, yeah, you're depressed, but it's normal. You scored high on this. We'll just keep an eye on it. In all that whole process, I did not feel that I was pointed to the resources or the people. And oftentimes we catch things in medicine and we tell people, you need to go do that. but we don't give them the phone number. We don't give them the resource. We don't give them the email, the brochure that says this is a support group. And so if you tell me get help, right? You're depressed, get help. I'm gonna go home and then I'm gonna get back into what I'm doing with my baby and doing all those things. And so sometimes you need somebody to make a plan for you. You need that individual to be able to be like, this is who you should see. So I think that, my experiences were uniquely designed to be able to help other moms. And so I've really enjoyed being able to link moms in that way. So having the network of birth workers. And so that's really how this kind of aligns. And also, being an ER physician, I see complications all day long, and so I know what to look for. So I can tell the signs and symptoms that, okay, that's not, you got to get that taken care of. As, moms are at home, they're not even complaining to their OB about stuff because they just, one, think it's normal. I'm leaking, it's normal. I barely can walk, it's normal. It's all part of the process. But when I'm able to go in the home and I'm, taking an assessment, I'm like, no, that's not normal. Like, we need to call your OBGYN. Like, you need to let them know this is what's going on. You need to go see this person. And so that's the gap that I feel.
Okay, let's pause here because this is one of the biggest issues in postpartum care. We need to screen for postpartum depression, but too often there is not any real follow-up.
It's like a doctor saying, you have high blood pressure. Hope that works out for you. No, we prescribe medication, lifestyle changes, and follow-ups. So why don't we do the same for mental health?
Right. And when a new mom screens positive for postpartum depression, she shouldn't be sent home with just a suggestion to get help. There should be some immediate plan, referrals, therapy options, and even a warm handoff to a provider who can start treatment.
And here's another thing. Moms don't always have the bandwidth to search for resources on their own. They're exhausted, overwhelmed, and navigating a new reality.
So that's why postpartum care, like what Dr. Chowa offers, or at least care coordination, is so important. Imagine if every woman who screened positive for depression had an automatic appointment set up for therapy or counseling.
That would change everything. Because let's be real, most moms aren't going to chase down help on their own when they're barely holding it together.
Exactly. And this is especially critical for Black women, women of color, or women who face higher rates of pregnancy complications. But they're also less likely to get follow-up mental health care.
So if you're listening to this and you're a new mom, advocate for yourself. If you screen high for depression, ask your provider for immediate next steps. And if they don't have a plan, demand one.
And for the providers out there, we have to do better. If a mom needs postpartum mental health care, we shouldn't just tell her to look into it. We need to hand her the phone number, the website, and the appointment time.
Absolutely.
Yes. Let's get back to Dr. Chowa.
I think you bring up a lot of really good points. I don't think a lot of people realize how much obstetrics and the emergency department overlap. We get a lot of patients who go in for a lot of the issues that you mentioned, right? Infection, that could be a urine infection, that could be mastitis, right? Bleeding. You are uniquely positioned as a mom, as a female provider, and as an emergency medicine provider to be able to help these women navigate these situations and provide them with resources. I think we don't always have time for that when you're like supposed to be seeing 30 to 40 patients a day. And so what you do is so important. I wanted to get your opinion on why do you think postpartum care is often overlooked and what can we do to change that?
Well, I think, as a society as a whole, I don't think we really value the recovery process. I think it's ingrained in us, right? Like women are expected to go back into work, 6 weeks, 12 weeks, right? We don't have, paid maternal leave in this country. You look at other countries, Canada, women are able to stay home for 1 year, in places in Europe, they're able to stay home for longer. Nurses are sent to the home, pelvic floor therapists in France, everybody gets a pelvic floor therapist, there is a value in recovery process. It's literally a sacred time where the culture absorbs them, right? I know even the culture I'm from in Zambia, when you give birth, you literally move into your mom-in-law's place and people are cooking for you. They're helping you. You're not taking care of the home. You're not cooking for people. You're not, jumping up and going back to work. You are literally taking the time to recover. There's an emphasis on recovery. In this country, there's an emphasis on returning back to work. And so we do give moms the bare minimum. And so because it really starts from just the overall culture of surrounding maternal leave and maternal care, we already are starting off and not allowing moms to recover, right? 6 weeks, 12, you had this big incision. If you had a C-section, now you got to go back. Your pelvic floor is barely recovered. Now you're literally leaving whatever, ailments or things that you've gathered through pregnancy and childbirth, and you're forgetting about it and you jump into work. That's why women often don't have issues with their pelvic floor until 2 years postpartum. And then they realize it was from the pregnancy, right? Or from the childbirth that they experienced, or they suffer with the back pain, or they suffer with depression that has just lingered, in that last year or 2 years after giving birth, because they didn't deal with it, because our culture doesn't allow us to deal with it. And so because it's ingrained in our society not to value that recovery period after women give birth, then in turn, it's ingrained even in our medical system. I hate to say it, right? Because there are many providers who want the very best for her patients, but even in a medical system, right? You think about your patient load, right? There's surgery that you all have to do, right? You have to see multiple patients in clinic. You have to deliver babies. You're doing a whole bunch of things within your schedule. You don't have the time to do something like this where it's like, I'm going to spend 30 minutes, an hour, going and checking on this mom and making sure she's telling me stuff. Cause sometimes they're just not going to tell you, because it's like, you're just dealing with it's so much. And so I think there has to be an extra layer. So as a community, we have to utilize the resources that are there, our doulas, our community workers, our therapists. There has to be a better system in like literally covering moms, because the medical system, unfortunately, is not going to be able to do this. And so that's kind of why I feel like postpartum care is just not looked at, because it's just overall, our society doesn't care.
One of the most common challenges that I've noticed for postpartum moms is lactation or breastfeeding. Can you share a little bit about any insights that you have experienced?
Yeah. So I'll tell you my story with lactation. I struggled with breastfeeding. I actually, in the hospital, my daughter ended up in the NICU. As a result, I did not get my milk for probably about 2 weeks. So when I thought breastfeeding would be a dance and it would be natural, even as a physician, right? And I had made up my mind that I was going to breastfeed by any means necessary. And so when I went into it and my milk didn't come, it was such a trigger for me mentally. And it actually what probably triggered my depression, because I spent a lot of time pumping, trying to get my breast to work. I did not sleep. I did not do a lot. And so I kept doing this, and I had hooked up all sorts of contraptions to try to make my breast work. And eventually what helped me was a friend of mine told me I needed to have a lactation consultant come to the house, who did a full assessment of my breast and basically diagnosed me with glandular hyperplasia, which means my breast didn't grow, right? And so it took me weeks of struggling with breastfeeding to get to the diagnosis that no matter what I did, that I was not going to get enough milk to feed my child. And so that diagnosis freed me. The lactation consultant freed me and allowed me to say, I need to be doing other things like bonding with my baby, right? And so number one, I think there's just more that needs to happen. Women need to just meet with lactation therapists before they even give birth, right? Because there could be problems that they could figure out beforehand that maybe they can talk to somebody about it. And so women get into this place, they struggle with breastfeeding, and then bam, this thing can literally trigger their depression, because it's like, it's tied, many women tie this to their womanhood. I'm telling you, it's something you're supposed to do. And so they just fall deep into a depression. And so number one, I would just say linking moms earlier to lactation, have somebody that can help them, that they have a relationship with, to help them navigate when the problems come in the postpartum period.
Okay, so let's talk about breastfeeding, because it's not actually as natural as people think.
People assume that just because breastfeeding is biological, it should be automatic. But in reality, up to 60% of women stop breastfeeding earlier than they planned because of pain, supply issues, or lack of support.
And let's talk about glandular hypoplasia, like Dr. Chowa had, because a lot of women don't even know that this condition exists. This is when a woman's breast tissue doesn't fully develop during the pregnancy, which means her body cannot really produce enough milk.
And here's the key. No amount of pumping, supplements, or lactation cookies will change that. But because women aren't told that this is a possibility, they end up feeling like failures, when in reality, their bodies just weren't designed to make enough milk.
Yes, so that is why prenatal lactation consults should be standard of care. Imagine if every pregnant woman met with a lactation consultant before delivery, just like she does with her OB. It would set realistic expectations, it could catch early supply issues early, and it could actually provide a game plan, whether that means exclusive breastfeeding, combo feeding, or even formula feeding.
Yes. And we need to move away from the breast is best pressure and towards informed is best. So women can make feeding choices based on what's best for them and their babies without unnecessary guilt.
Yep. So let's get back to Dr. Chowa's interview.
I think that's a great point that you make. I think lactation consultants do amazing work. And I think one resource is the Lactation Network. So you can always find somebody who's still practicing, because a lot of times you create a resource and they're gone, right? They're no longer providing services. So having up-to-date, accurate information for mothers is really important. What do you think about partners and like family and friends? How do you feel like they can best support a mom who's navigating like lactation challenges?
Yeah. So number one, I think before you even give birth, you have to have everybody who's going to be in your circle has to have a role. Now, I'm very big on planning for the postpartum period, because I think once you get into postpartum, you're in the weeds. And so you can't think clearly. You don't know how to delegate tasks. You're angry because people are just want to hold your baby. You don't know how to tell people you don't want them. You're not sleeping. The house is dirty. You don't even have time to bathe. So you're in the weeds. And so I tell people, like, when you're pregnant, you need to sit down with your spouse or whoever is your support system, and you need to make a plan. You need to think about, like, who's going to be allowed to come into the house those first couple of weeks? Who's going to help us? Like, who's going to be cooking meals? Are we going to be ordering meals, right? I know mom is really good at this thing, so maybe mom will come and she'll help this. Everybody needs a role, right? And you also need to, write in there and say, when people come to see my baby, like, they have to do something for me, right? Like, they got to clean my house. And you have to verbalize this to people, because people don't know. They come in a visit, but they want to hold the baby all day. They want to feed the baby. They want to hold the baby. But you don't need help with that. You do that best. You know how to bond with your baby. You need help around the house. And so I think people need to make a plan on, like, their support system, right? And I always emphasize this. It's part of the reason I wrote my book called What to Expect Next. And in it, there's like, who is my support system and what will they be doing? Because moms need to plan and write it down so they know who to call for what, right? And so there's a huge role for family members to play. And I also emphasize for the spouse, right? Most, men, I'm gonna say men, because, they sometimes don't know how to help, with the woman, or don't know what to do, right? Because it's like, I can't breastfeed, I can't, like, and so they don't know their role and what they play. The woman is waking up, she's breastfeeding. And so they're kind of like lost sometimes. And so he needs to know, like, while I'm breastfeeding, maybe you can change the baby, burp the baby, put the baby back to sleep. It's like a simple thing, because a lot of us as women, sometimes we do get frustrated. It's like, when I wake up, I'm staring at him because it's like, he's just laying there. I'm breastfeeding and I'm changing his diaper. I'm putting this baby back to sleep and look at him snoring, enjoying his sleep. Don't know. Like, you have to be clear, like, this is what I need you to do. And these are the conversations that partners need to have. So I think everybody needs a role, and they need to know what role to play. And so you need to be able to verbalize that. And I think that's a lot of things that women don't do, because they just think we love each other and it's going to be great. And then postpartum, it's like, it's a nightmare, because nobody was told what to do. Everybody thinks they're doing something, but nobody's actually doing anything. Like, it's like people just need direction.
Okay, Kamisha, let's be real. Pregnancy and birth get all the attention. That's the big moment everyone's preparing for and doing everything for, right?
Right. But what happens after? That's the part no one talks about. And honestly, that's where things can get real tough real fast.
That's why I love that Dr. Chowa put it on paper in her book, What to Expect Next. It's like a postpartum game plan, and y'all need to get that.
Because listen, if you don't have a plan for the fourth trimester, you're setting yourself up to struggle. This season is already stressful. Why go into it blind?
Exactly. So whether it's through a book, your doula, your provider, invest in a plan so that whatever comes next, you're ready for it.
And as a part of the plan, your partner and support people are a huge influence. Many want to help. They're just waiting for instructions instead of taking initiative.
Yes. And here's the thing, postpartum moms shouldn't have to manage their help on their own. If she has to tell you what to do every 5 minutes, that's another job on her plate. So, partners, if you're listening, step in without being asked. So, here are a few things that you could do that postpartum moms may actually need: food and hydration. Keep snacks and water within reach, especially for breastfeeding moms. How about stock the postpartum essentials? Have some pads, peri bottles, compression stocks, pain meds already, sleep support. Take over the night shifts when possible, or let mom nap throughout the day. Household management, dishes, laundry, tidying up. Take charge without being told and taking direction. And lastly, advocacy. Be her voice at all those medical appointments. Because if she's in pain or struggling, she may not speak up and may need you to do it for her.
And let's not forget emotional support. A simple, "you're doing an amazing job," can go a long way. Because postpartum is hard, y'all. And moms need to hear that they are seen, valued, and supported.
Absolutely. I think, you bring up such a great point. Like, when it comes to the pregnancy and the birth, like that's like the big event, right? That we're all leading towards. And then it happens, but no one's prepared for what happens after. So I love that you have put it onto pen and paper for people to be able to read with your book, What to Expect Next. So in your unique position as a postpartum specialist physician, you've seen things, you've been there. So what are some particular red flags or concerns that postpartum mothers should like watch out for when it comes to their postpartum recovery?
Yeah, I think the big one is I'd say abdominal pain. Sometimes I think moms just think they underestimate it, right? Just had a baby. Well, if you had a vaginal delivery and all of a sudden you are in severe pain, a couple weeks out, you need to tell somebody about that, right? I had one mom's like, every time I'm breastfeeding, I have to take oxycodone, and I'm like, and it's been 2 or 3 weeks. Like, that's not okay, I mean, this particular mom did not have a fever or anything and ended up having retained products, a retained placenta, had bled. I think about her, she just had pain and nothing else. And so she made it by the grace of God. So I think that's number one, the abdominal pain that women need to worry about. And then there's the fever. If you're having fever and abdominal pain, fever, other symptoms, you could be getting an infection, and that could be a really big deal. The bleeding, I think most women know that if you start, getting a gush of blood, like that's not, you need to go to the ER. Don't think about it, because if you start, hemorrhaging, you need to go to the ER. So most women, I think, understand that vaginal bleeding, like heavy amounts, is not good, right? You're going to bleed a little bit, but you shouldn't be gushing blood 2 weeks out. And then the other thing that I always have moms guard is just their mental health. Sometimes people are always thinking, I'm just crying, but it's just her hormones, right? And so they really need to check that, because I think sometimes they underreport. And I will say I did that, right? I literally would sit and cry. And it was at one point I realized, okay, this is more than baby blues, because this is really intense. So I think sometimes we just have to take an inventory as moms and just say, is this like normal, baby blues, or is my my crying really excessive? And the last thing is blood pressure. I've been to many homes where moms do not have the blurry vision, moms do not have the headaches, and end up having elevated blood pressures and are admitted with postpartum preeclampsia. And I don't know, maybe they have the symptoms and that they're busy and they just don't pay attention to it. Or maybe it's like, I haven't slept, in days, so therefore that's why my head hurts a little bit. Or I don't know if that's what it is, or that in true moms are having no symptoms. I'll generally go to a house and just maybe see them for some reason and check their blood pressure, and then it will be elevated. And I'm like, we need to call your OBGYN.
Okay, so let's talk about the fact that way too many moms suffer in silence. Part of that problem is that we normalize postpartum struggles. Moms think, of course, I'm in pain. I just had a baby. Of course, I'm crying all the time. Hormones, right? Of course, I'm exhausted. Newborn life.
But some of these symptoms aren't normal.
Yeah, let's break them down. Number one, severe abdominal pain. That could mean that you're having a retained placenta, infection, or even a blood clot in the uterus. And if you're in constant pain beyond those first few days, please call your OB.
Fever over 104 could be a uterine infection like endometritis, or it could be an infection in your breast like mastitis. Lastly, it could be a C-section wound infection.
Yep. Let's not forget about heavy vaginal bleeding, soaking a pad in 1 hour, or passing large clots. This could be a sign of a postpartum hemorrhage. And if this happens, you need to go to the emergency room immediately.
Blurred vision, headaches, or swelling could be postpartum eclampsia or preeclampsia, which can happen even if your blood pressure was within normal limits during pregnancy.
And also, let's think about unbearable pain in the legs. Yes, there is some swelling postpartum, but if you're having one leg that's larger than the other, or it really hurts to walk, this could be a sign of a deep vein thrombosis or a clot in the legs.
Persistent sadness, hopelessness, or intrusive thoughts. This could be a sign of postpartum depression or postpartum anxiety.
Yes, postpartum depression and anxiety can really sneak up on you. So having a therapist or support group ready can be a game changer. If you want to learn more about it, actually go to Aparna's episode, which is episode 10. She's actually a psychiatrist who specializes in women's mental health, and she herself suffered from postpartum anxiety, and she gives some great insights about this topic. So this is what I tell my patients. If something feels off, don't brush it off. If your gut tells you something's wrong, trust yourself and seek help.
Right. And because we normalize so much of postpartum struggles, women often don't know when something is actually dangerous.
Yes, that's why we need better postpartum checks. A 6-week follow-up is just not enough.
Nope. In fact, the American College of Obstetrics and Gynecology now recommends postpartum care be an ongoing process, not just one visit.
Yes. And can we talk about the 6-week clearance? It's a myth. It needs to go. Just because your doctor says you're quote unquote healed doesn't mean your body, your hormones, and your emotions are back to normal.
Absolutely not. Recovery looks different for every woman. Some women feel fine at 6 weeks. Others are still struggling with pain, weakness, or mental health challenges months later. So here's what postpartum recovery really looks like. In the first 0 to 6 weeks, healing from birth, managing sleep deprivation, and you are adjusting to newborn life.
In weeks 6 to 12, your energy is slowly starting to return, but your core and your pelvic strength may still kind of be weak.
In months 3 to 6, hormones are still fluctuating. Mental health challenges may peak.
And 6 months plus out, the full body recovery is still ongoing, especially for C-sections and those who had more complicated birth injuries.
And that is why postpartum care should extend beyond 6 weeks. Women need pelvic floor therapy as routine care, just like in France, where every postpartum woman gets it.
Yes, they need ongoing mental health screenings, not just one test at a 6-week visit.
And they need more postpartum check-ins, especially for Black women who face higher risks of postpartum complications.
So for the moms listening out there, if you're months postpartum and you're still struggling, you're not alone. Your recovery is your own timeline, not what society expects. Let's get back to the last part of Dr. Chowa's interview.
What are the top 3 tips you would give moms to kind of set themselves up for success going into the postpartum period?
Absolutely. Plan. You're planning for pregnancy. You're planning for childbirth. Everybody has their bag packed. They know what the baby's going to wear. They know everything. And then they don't have a plan when the baby goes home. Legit. You can survey many women. They will tell you down to the literally leaving the hospital what they're doing. They have no plan when they go home. And that's like saying, what does the first 24 hours look like? What's the first 48 hours looks like, right? How are we going to be navigating this? How are we going to be as parents going to be doing this? Who's going to be in the house? Right? What am I going to be eating? Plan everything. What am I going to be wearing? Whatever you need to plan it, right? And so number 1 is planning. Number 2, just get a blood pressure cuff. Just have it in the house, just standard. Just keep it there. Because those first, few weeks, you want to definitely make sure that your blood pressure is not creeping up. Because you could be fine in the hospital. You could be fine in childbirth. And then next thing, bam, your blood pressures are elevated, a week later. And so just do it. That's that one. And then the last one I'd say, every woman needs to see pelvic floor therapy, and every woman needs to see lactation. Yes, you may say, well, I don't need to because I'm not leaking or I don't have any issues. Just see them. Because, you literally just popped out a human, right? You carried a baby for 9 months. Things have shifted. Your pelvic floor is not the same. It's not. So even if you're fine, a little maintenance therapy, a little tune-up, because you may be fine now, 2 years later, you may not be fine. Right. And so I always recommend every mom sees a pelvic floor therapist. Every mom just makes contact with a lactation therapist or lactation consultants. I just always have that. But definitely have some people in your back pocket so that when problems arise, you know who to go to. And then the last thing is people, like I always talk, people don't know who their pediatrician is going to be, right? And so that relationship also matters because your pediatrician also can pick up problems with you, right? They often are picking up the depression and picking up these things. And so having a safe place also with the pediatrician is helpful so that you can just tell them how you're feeling. Everybody in your circle, you just want to be for you. And so this all comes with planning. So build your village, plan, definitely guard your peace.
Really such good advice. And I'm just so grateful that you have entered this space because I feel like most women who have had a baby, they can identify that there's such a gap in this period of time. And like, what a blessing that you're able to stand in the gap and really save lives. You have saved some lives postpartum for sure. So I was hoping that you could tell our listeners a little bit more about your work, and what services you provide. And how they can get in contact with you if they'd like to.
Absolutely. So my business is called In Care to You. And ironic, it's emergency services, emergency care to you, right? And so it's really just filling gaps. And so I want to make sure that you are able to access a physician when you need one. I serve as an advocate for my patients. Sometimes I have to send my patients to the emergency department. And so I tell them to let me know where they're going so I can call ahead, because sometimes that conversation, when it comes from a physician, it's received differently, right? Or maybe I'm able to, to share what my observations are, right? I'm worried about X, Y, and Z. And so I do that for my patients because I feel like every mom needs an advocate, right? I work with doulas. Doulas do advocate for their patients, but I have the unique lens of being a physician where it's like I can be able to help prescribe and, to be able to get the images and to be able to talk to my colleagues. And so for some moms in particular, when I think about high-risk moms, right? Moms who spend time in the ICU, moms who've had a difficult, childbirth experience or prior birth trauma, they really want to make sure they have an extra layer of care. So I do pride myself that I am able to give them that reassurance and comfort that they don't have to go through that alone. So that's what I do with EM Care to You. My services, are kind of full service on-call doctor. So I will be your own dedicated physician for whatever period of time that you need me. And then I also have what I say a la carte services. So in the spur of the moment, if you need a home visit because something has happened or you need somebody to come and see you for your C-section scar, to see you because maybe something is just not, you need to talk, I'm able to do home visits and also able to do telemedicine visits as well. And a lot of what I do is linkages to care. So I have a big community of birth workers who I work with and we partner with, and I try to get my moms to basically be seen by them. Most of the people I work with, they go inside the home because I don't like my moms to have to leave if they don't have to, right? So a lot of things I can handle at home so mom doesn't have to leave her house. So those are the services that I have within my business.
So amazing. So important. Thank you so much for all the work that you do. And thank you so much for coming on the podcast because you shared such amazing and important insights.
Thank you for having me. Keep doing this. I love it.
Thank you, squad, for tuning in. And just to have some information, Dr. Chowa is based in the Metro Atlanta area. To learn more about her, visit emcare2 and then you.com. We hope you enjoyed today's episode. See you next time. That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors. Because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad. And check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.